Yawe Olive, rorit ko jagan rong jake programin made broadcast in Springdale School District nga anida tabi ba ni kanono ipen Damon Donnell may coordinator ng student services ilo Springdale School District elang yalan cibang ko may chikilege ene dilu kun cibang cilim cibang rujugurain ngako marong chojim peripem imrong jake oliven melelekin rene Jouj.
So, Anita, thank you for that introduction. I'd like to just start with the student services piece, just cover some pieces of student services, which would include social workers, counselors, and nurses, and school-based health clinics. And just to make sure our community knows that we have 11 district social workers serving 21 schools, 53 district counselors serving 31 schools, and 37 nurses serving 31 schools, and 4 clinics at elementary schools serving the community.
Jangan kali karot ngana oleh prori ron jaga gayor, emen cikin ko merong ilang ngan pagcibang, cuan social worker, romer merong cibang mayor cungol cuan social worker ilo district ini bercibang rongol cuan cigul ko, para ino ilo ikijien counselor oleh mul cilu. District Councilor Romer Rajbarchar Wali Penchilungul Juan Chugulgo. Naj or Chilungul Chimijuan, Naj Romer Rajbar Wali Penbar Chugulga in Chilungul Juan. Emeligada Kali Karot Gamen or Emen Clinico, Emerald Perilo Chugulga in Paraino Emen Chugul.
Our community can access any of these groups or these individuals through our school website. They can call the schools and access these individuals, or they can access them through the school website and go to meet our staff, and then they can access them through email.
Kung meron tabar yalan si bangkay nila mi call chugul go ag email ag tibara do erum kachida yalang ko kanan chalagan yalan si bangkay ni meret pelak ngana al bang rujugure ni pamali go kachujo kata community.
Okay, so I'd just like to go over the social worker's vision, which is to connect and advocate and resolve and empower families. And then, okay.
Go ahead.
Okay, and also the mission to provide services to students, families, and district staff to support and promote each student's academic and social success.
Social worker rain and not gayorilo chugul. Vision array malagay wire peren marun tabare kanono kagem pagalang dak pagdok mejalan problem ko ngancibang parainot kakajor yang ini vision wire mission wire jangan air sibang ikijien service ko ngan rujuro family wire parainot arijar barolo district parainot kaciong sibang ajriro najiri ikijien air kadak parainot air merong tabar area go iligner perilo chugulaga tenba social ilo air perilo bilijon rocha.
Oops. And I'd like to go over the 3 pillars of the social workers. Those would be listen, assess, and support. And we want families to know that we want to listen with the intent to understand what their issue is rather than to reply. And we held no judgment for families. We want to make sure that families know that we've all been there. If families are struggling or if they need resources of any kind, whether it's food, clothing, any type of resource, we are there to help them. We'd like to help assess where they are and to find resources and advocate for their needs. And then also we'd like to help them resolve their issue and empower them to resolve their issues in the future.
Human social worker or chilu jorgo merawr kein gajon raja ronga jage ngana merong panega family ge nilair nalelem chalata ko raja iguji ijella guner kwala nganer ta raja igujin chap chajer lo chaprod wawen agan nalele ga ge yerim ta aiguji waya pilaro kein karwo ijilo air ne charwali pe yerim lale ta menina iguji wan family nim tayo merong resource ko merong panega yer nganer tabarol ben meninay gujigay na air. Chilu, ilo air sa poda pamali again baran marungun. Ano kagaya takir, kagayorir baran marungun chala kilen tabar meninay gujigo air magi ilo, tokay ilo air net kapuk chibang.
Okay, also, I'd like our community to know that our social workers served over 11,000 students and families last year, and they provide them with a list of resources. Community resources could include food banks, homeless shelters, job training, mental health services, food and clothing, bedding, utility, and rent assistance, and then also immigration assistance. Stephen Koger is the director and lead attorney for Arkansas Immigrant Defense Organization. He's fantastic to work with. We've had a great partnership with him. And then also crisis intervention, social skills, emotional supports, behavioral supports, transportation. So if a family doesn't have transportation for a health or medical appointment, we can help with that. And then also families, during COVID, a lot of families are struggling financially, and we can help families in transition or families who are experiencing homelessness. And then also with attendance and FIN support. Social workers are there to help. They are absolutely fantastic, and I welcome all communities to reach out to our social workers.
Yung minochar balgay na social worker rain right survey tarin chungol chuan tao yun rijulum pamale ilogar chuan tao yun radon yun puchugul yan 19 tongan 20 social worker rain par lang listen community resources ko yaman chibang kome ramarongin kakayangan kachojo pamale chibang air yemi yalan chibang kay ne go ba ano community resources ko yo ko ramarong talang yung pagkijeri ako food bank ko para inot choko marungin elolo chiginair per chokem ka per ilo torero jay wit para inot rene trainier ngan air ka air terbal ayumun bar resort gay inot mental health ray bar chibang ikijien mga plelak nugunu palir para inot kein air kigi ray bar chibang local utility bill go air yang parainot rene air HIU menot community resources de barwar immigration survey ya yalan cibang ko kitchen immigration celgun cara manboyor chuang lawyer o chalak wananan charbali pair Stephen Koger director lead attorney on an Arkansas Immigration Defense Organization paraino di kitchen crisis aga mengo repinche yoni social skills are marungan itongan ijoko jay with chibang yilikin pamle ko aram paraino di ang jaga ko ar sapod gichen mulina ajiri mul kap wawin feeling ko air transportation paraino dengan mental health kap medical appointment ko me anrora jay with yalan chigam takata kanan markali karge ebarur yalan chibang ilo air kokon pamali ko me right pero da right all human category na me right ba umles chala chigina air chwe right chibang air pe ren marungun word chigina air chwe paraino social worker right chibang kan attendant da kan jikuul na dalem jikuul wala paraino fins aka family in need of service support da me right charbalipen ka jojo family social worker rain rabar pe jangan chibang.
And then also, again, just talking about our social workers really pride themselves in serving our families who are experiencing homelessness, and they really take great pride in that. That's a family at its most vulnerable, and if any of our community, our families or students or anybody find themselves in that situation, we really encourage them to reach out to a social worker.
Juano me yo maleje lo wel gunai wichi bangi siap eligiligen reach out kajion tabar social worker ranai berin renci bangi go bayala ber monana in pokpanair ilo cibang rijugulum pamalegen meret pello atang kein elapta da ilo yenin me jet perium pandemic.
And then these are just some of the services, the common services that social workers provide, which could be food, clothing, housing, utility, bedding, and hygiene. And we have great community partners that have made most of these possible.
So the area me social worker rain right chibang ye kein karreo aga men ko merene cibang ke jengane reo paraino chicken kigi ko war mga kijarangan an narngun war mga nugunuk men ko palir paraino cibang ikijien housing kapek chigner chwe paraino pil ko air eno charo men training men again.
And then also we've moved away from, due to COVID, we really are shying away from going to people's homes and delivering groceries, but we're moving to, again, through the generous donations of community partners, through if families are assessed and it's determined that they do need groceries, then we're moving away from delivering groceries to having groceries delivered through other services like Walmart Grocery and other services, similar services.
Chijaraman by a bar word to an answer with you air Rijar rain kaciyong cibang telibar mangayangan pamilya merajai wikijir eko kia jalukan an community cibang pokonanem cibang to kia rijar rain ejak wair talem nake telibar lo mangayagia remarongin cibang bisnes jikin rajai wiji mangayagi ini yung telibar ilak meninai wiji dengan pamilya rajai.
And then also here just some other services that social workers provide, from providing resources to emotional support, to crisis intervention, and just various other supports.
Elang area ko may social worker in worker in Rajabar Chibang ye. Right, etalangan ilo visit again para ino charbali pens taban jikuul. Adalain report again ni mesial group again. All even resources again me agyalan Chibang again me charbali. Ikijien paraino attendance anajero edalangan jikuul me rilang kelamay kot paraino da ilarion menego repin elaptada Chibangir emotional support menio ebal labin ilawane air Chibangir gantago regulator tulawa.
And then also just I've said this many times, but I wanted to say thank you to our Springdale community partners for making all of this possible through the Social Worker Fund. That's literally assisted thousands of students and families.
Elabar kamulo na community partner rain boy. Chibang inge mjana dalem chibang taujin arami jen chinerum chemerangan rijar barro peren marungin chibang family again kachojo ilo meninai wujagain ayer.
And then also this is a big deal right here that many families that I've talked with over the last few weeks really are unaware of this emergency paid sick leave for COVID. This was part of the Families First Coronavirus Response Act. This act provides up to 80 hours of emergency paid sick leave for full-time employees. And then also part-time employees are eligible if they meet the criteria for this. So I want our families to know if they do get COVID and they have to stay home, that this is a law that was created to provide families some relief so that they're not just at home for 2 weeks. Let's say they're out of sick days, they would have up to 80 hours that they could still be paid. And this was a big deal because I bet there's been 10 families in the last 2 weeks that were able to take advantage of this and not lose their homes because they were able to get caught up on their rent through their employer paying their emergency paid sick leave through their job.
Parchuan issue jakanan atarege ikijien anchet pamle jabulukun melelegan emergency sick leave na me ejelet COVID rana mer menjadi pengenangan mijin COVID. Perilo pamali first coronavirus response akan me agar white penilo macung rally dagini yain. Rai karalak ro rally to ngolawa ngan full time rome recerbal full time ngan merong kalai gi rilo air chaku. Ngan rame right part time Rajabar eligible subject ngan takar kome mijer ligdum rajalap rain me pero dilo part time aga jangan Chibang ole pengai wajalo ko wanangan mi kon chala gayor chuan paneone chibang yu human ruo wi yo me pijel la unam chapter wale me chala chibang e maron chibang yu ngan kala renam wale ben koban e chala chignam chwe we ragala yu rali to mulawa.
And then next, our counselors. I can't even tell you how many hats that a school counselor wears. They wear multiple hats, and they are all fantastic in our district. I encourage our community to reach out to their school counselor if they have not done that, and build a relationship with our school counselors. I'd like to just read through their vision. Is the Springdale School District counselors will ensure all students are prepared academically, intellectually, and emotionally with the knowledge and skills essential for lifelong learning in an ever-changing society. And then also their mission, that they will facilitate in the academic career and personal social development of all students to help maximize their potential as productive human beings and prepare them to function effectively in an ever-changing society. Again, I cannot tell you how great our counselors are and what they wear. So many hats. With COVID, there's going to be new challenges that come forward, but they are fantastic, and I'm excited to show you what they do also.
Ijellagun social worker rana bar worchuan kurube melgun labi jokona ilo chibang ilo chigin chigul ngantim jab elegligan reach out them tabarate counselor rana right perilo olive chigul jabro diene ora meni nai gujum pojai guchibang ilo chabro wa we ne rene kurubinar mi jochuan me rome komarun bar reach out them tabarate Pijene wire gauge baran tabar aole bilo chalakal jikla aole berjugurum kabe wajer baran cap tabar kodile wire chugurum pak chalago aran parainot kabe wajer emotionally itu lawa baran chalaga ramarungin pukchat skill go merane chibang rile wire rutolakun kitongan chicken chop aga chalamai ta gore pejagin chalamai lo meurin. Ever I know virtual and counselor rain mission, wherein bar Pokona air air pigot chigur you rain, into what chala lagujan chibang air, peron tabarchet, why when going and tabar or a marwin kadaglo chicken chigul, Emperor no tabar air baron tabar yoyam ilang data and which other meaning and kabodir, virtual and allen baron marun tabar. Many nights go really
Okay, and then the next piece is just counselors are just master relationship builders. They pride themselves with the relationships they're able to build with students, parents, and teachers. And really, it's all about the relationships with counselors. It's just relationships. Mm-hmm. Dr. Cleveland really pushes this forward with relationships in the community. Counselors are great with building student-to-student relationships, student-to-parent relationships, student-to-teacher relationships, and student-to-community relationships. And they are also fantastic at bridging the gap and bridging that cycle of home, school, community, that whole piece of relationship that's part of that also.
Counselor rain ge well mukone kalman law jana ge chem jaray war rajin jebe war nganajiri ron nejira rijugul ngan rijugul aga rijugul ngan cineram cemer rijugul rongan ragi roeram rijugul rongan community all ben ngone kalman law jan kan ta vandilang takke jika relationship chem jaray war pendron aurogin mengain jugul community yo kabi jugne ne family yo ngan charmali pendron.
Also, I'd just like to say that we are all aware that students thrive when they are safe and protected, and when family and community connections are stable during and nurturing, and when their basic needs are met. And we've talked about a lot of basic needs so far with food and clothing and all those things. But COVID has really disrupted our students' lives and our families' lives, from their health, their development, learning, behavior, their family's economic security, and their protection from violence and abuse. Counselors are really going to have some new challenges with students who are experiencing anxiety, with adults who are experiencing anxiety. And then also with those who were already the most vulnerable, who were just kind of living paycheck to paycheck and just barely getting by. And then this has caused all kinds of, job losses and food insecurity and housing insecurity and all those things. And then the loss of family and friends also. So they're going to be dealing with students who have lost parents or grandparents or aunts and uncles. So I just want to say that our school counselors are amazing. There are some new challenges as we start to reopen schools, but our school counselors are amazing. And I really encourage our parents to reach out to school counselors also for all of these supports that they could put in place for families.
Counselor Rain ilo jikuul ga ramarungan preach the gap ramarungan kokon kon ijo ko me tijelo ko tijai wichi bang yem Rijuku Rain ko jala ga e bayar ilo chebala to win ga Raju to jan kan elen kain me jato to me rajale to yer ga nangan me jin me ka joji tabare pia Kobe de menyan lukun chele de meur gain an Rijuku Rain e ai raje meur air regala ai reka da muli rim family gain elapta da rorin meur gain pa pecha gain ai lo chonu ga barmat nangan me jin pandemic ini menyan lukun le to elan kain menoko me chile dim raga wada ta paraino Rijuku brutoro Eto air isolate in perijogo me respira, no the pa. Could you perlu janaro perum, pero di mogo maram, human island, you lord kagi and give me a COVID lidong and kiji change of maroon come money. Elang elangilo mejato to air chedriti pre chedrelukun nana air meur aga rutoro me and paraino de mejair kada baran Kaligdak, Imray the hum lala tayo and it put chicken, Yiloan, Nangan Mijin, Chilot Kajuj Kachujo. Rijuku Jan family again, a way I wrote Pinar Maroñ, Physic and situation in Cheveria Rain and Richard COVID-19. A way I'm tight Pajatwana olive, Chedaruji Chob wire, Chedaraja I would Manga. Ano dan chat pernami jim pejarajan chukula kata barrio in and council rainbow and chibang kajilo oliven majano in alangin a chino chukul pomerong to chabro dienum kanono perum pug chibang chap eligilik quajalo family amai with chibang lo chabreo de area Parchuan area me council rain reveron parchibang yegichin mijigi in me eno daro chalilo community in arge epayan lengroim jair Mejem ila ko jan kechenot COVID-19 in. Our ragaboyen tabar councilor rain waran marong. Chibang ke ilawan Faisy meurwan elang jan chinerim chemer chibur antiro aram angkorwan meperin family again at chenot nangan mejine mo jap likut bokonin makaya may labisyo konan Councilor Rain nga na chibang ilo chabaro wawin and other yagin kalikari.
Okay, I just want to go over just what the three pillars that I see that counselors really provide for students and families is just that they provide those student skills, giving students the skills that they need to become their own problem solvers, whether they be interpersonal skills or social skills or academic skills. And then crisis intervention, providing support to students and families during crisis situations. This is one that I really have to think about a lot and make sure I remind myself just to take care of myself so that I can take care of others. And I think that we all need to remind ourselves about that. And then mental health supports, the Ozark guidance support, Youth Bridge and Vantage Point and family counseling. They offer many, many other things. I'm just trying to put the big ones here. But again, I'm going to encourage families to reach out to counselors for all of these services, any or all of these services.
Counselor Rebar or Chilu Pillar Gome area or Rebar Pogisiverano skill one Rujuro, Ricada Ginirber and Maroin Jalan Mage, non Mejalan problem again, Air Magam Parano, but Maroin Jala, what I skill in Tabar Roger. In Perilu Religion Roger, Emelaptada, Parano Chibang Ergan, academic skill wire, Eloire, Locata Choir. In Cargo, crisis intervention, Eloire, Chelamai Minagain me repin, Rajar Letok support and family, Rujul, Stabro, Elo Yenin, Yen me regulate Kate. Elaptada, and Ibalamanawe. inja pala mana ko kan an eji meurangan roja ta alap ta da keji barok par eu magi aku magi em kali karro the human mental health support the or emen chicken ko mer merong chibang those are guidance youth bridge vantage point family counseling dijagain merong chibang lo chapro di issue ko me chelo ke chene jai ku chibang ye aga ngai rane chule ne loege family again rajai ku chibang chien.
And then I want to move on to nurses, which is led by Kathy Launder, who is our director of nursing. She is absolutely fantastic. She leads all of our school nurses and leads them in that mission to provide the very best care for every student, thereby promoting each student's health and academic success.
Ito wala tako di kichien na jere me rejibar praino perilo Peria inci bangkai dengan keji meredalangan keji umun Kathy Launder o me karakter dengan oleh bener jerain ilo as school district in. Emise ne air parent dela gijo emantada kader chono der merongan keji barok keji agar rijuguro kamane we ranca baya jeme uruat agar labalak ranbar tabaragilo air kata. Uci jalan ngarobane jeme ur emana air kata.
All right, the next piece is just, I wanted to make sure our families understood the depth of services that nursing provides to our families. So they've done over, last year they did over 12,000 vision screenings, over almost 12,000 hearing screenings, and over 2,000 scoliosis screenings. And this next one really is touches me at my heart because they provided 583 students with glasses, which is just over the top amazing. I wear contacts, and if I didn't have my contacts in right now, I couldn't even see this presentation. So I just think about by helping students get those glasses, they've helped students become doctors and help students become lawyers and help students become computer scientists and help students become who knows what they want to become. But, you know, if you can't see, you certainly can't perform academically. So that's a big one right there for me. Over 7,000 flu vaccines and dental services. I will tell you, I've had toothaches before. And if you've ever had a really bad toothache, you know that you can do nothing else except focus on that toothache because it is just overwhelming and back pain. So I will tell you that for them to provide 2,193 students with dental services is just over the top amazing. And I want our community to know that they can reach out to our nursing staff for services for our students and families.
Jadi cibang kain me najarin lilangan family ko di kecien kecien aga takdagi mejair or chongo ruo taujin cimjon pugi cimjon ruo mejair cibang kecien ronga jaga aga keron jako jaga lojil ngire or chongol juan taujin radmion pugi radmion juan kecien jaga rier la arriba scoliosis dengan spinal cord wire go ruo taujin yung ruo medkila jano dar chala organ medkila nge ba chuano me merong lo ta go jridi apan ridi lo kan chugul apan tabaragilo an kada apan merong tabaragan chugul ba belo ita go kamani aga yo limna bu rali to ngol chilu ruju ro me be le lo gair medkila yang paraino wain pulu gangai mecit pugi ya kayak simjon tau jinar me jam jet cibangai emigicien kam manangi ci jala bangai chuano e matangin akai pelo kulaje e ban lukune manan kamanan kata galangai e matangin e mai ci kamolol bar maron kar cibang ro tau jin cibugi arad nyongol cilu rijuguro igicien kam manangi.
And then last but not least for nursing, the nurses also provide services to staff through the HAR-BER training, Stop the Bleed training, and CPR training, and many other emergency trainings.
Training Stop the Bleeding kabajarak anto alok pododo ngan olive stabro member trainer par CPR ngai kachiong par kaman keduan cuan eo me e jago ya or biar trainee elang staff yang paraino di jeni emergency radum cuan call ramai.
And then lastly, I'd like to visit about our school-based health clinics, whose mission is one community healthy together. They are led by Miss Mary Miller and Miss Sarah Jones, and just absolutely fantastic individuals who have kids at their heart and just serving kids every day to keep kids the healthiest they can be.
Ikijien area neligdada me by school-based health clinico me kajar balingan barad ano tukoda ejemor Mary Miller and I'm sorry, who's the other one?
Sarah Jones.
Mary Miller and Sarah Jones at Carrero me right jibang ikijien clinic in me right perilo emenian jikuul gain. Mijane wairin we tamaka wair by chuan chukujugun per raja me uri penron. Kattaberoin baran merun taberole.
I really believe that our school-based health clinics are one of our best kept secrets in Springdale. And I want our whole community to know about them so that they can access them, because there's so many services that they can provide. Those clinics are located at Jouj, Jones, Elmdale, and Parson Hills Elementary. And they're staffed by a community clinic with an advanced practice registered nurse. It's an APRN. And medical assistants who provide quality health care for our students, families, and staff and community. And some of the services they provide are primary care, non-emergency care visits, care for illness and injury, basic lab tests, strep tests, flu tests, and other blood tests, wellness checks, sports physicals, comprehensive annual exams, and immunization for students who have ARKids or are uninsured, and follow-up visits for referrals to specialty providers, which we'll talk about on the next slide. And then if our families don't have transportation, we can provide transportation for students and their parents to the health clinics. And then here's some numbers that were just really representative of what a great job the school-based health clinics do. They had 14,330 patients enrolled, 9,000 were children, and 3,400 medical appointments last year.
Jakanan kanuna kunjadian area gain me chicken takadagin a clinic kain ilo jikuul gain ramarong jibang kajagage da bayore men jikuul go me ramarong edalangani emor clinic Jouj, Jones, Elmdale ka Parson Elementary School. Clinic kain ga right stabi rijarbar rain eber rain me relgun tijam lagano rain me advanced practice registered ne relgun tijam lagilo air picture balin ne jare ba APRN rome richibang roair paraino dum richibang air lale rujugu rain pamale gain stabran chugulum community jadian jibang kain me right jibang air gaga go ba primary care aga kabaro ne nan mi go me rain racha buguna wat paraino ko me racha emergency ano ngan ngay konangan me jagam nangan me jaga ko dalaga minagain paraino lab stage ko me ilalangan strip yung paraino pulu yung check pada doktor wellness check yung paraino physical ko me recommani lo olive iya meron barkamani paraino wa ko nga najiri im rome orai kids rome rachel kay rinchuran meron bar refer ko pokona talim lo special jaramay yang perkali karboy or transport agent in Springdale School District and all of rujugu rom chinerum chinerum rore lalir yang mangan poto chat nampai ilo chongrad mi on rongolio matan nampakay ni mrat chibang rinangan ni met chongole mang taujin chilubugi chilungol yang ajiriro radum jon taujin gap appointment ko ngani ikijien ejmor chilu taujin apui.
School-based health clinics, I want everybody to understand that all students, parents, and staff and community members are welcome, that they can also provide follow-up appointments and referrals for pediatrics, prenatal care, dental, integrated behavioral health, physical therapy, case management, diabetes, self-management training, nutrition counseling, and medication-assisted treatment, and many more.
Kali karo dilo ikijien yalan cibang jan klinik lo jikuul ngan rujukul rom cineram cemeram stabe wan jikuul kaminidiin ya barwar chat serbe jugo me rujar barren raje lilongan lo cibang lo kaminidiin community klinik go eleng result go me raj paraino pelongan rujukul rom pamle go air stabe ran jikuul klinik ini marungun koneke rujuku renim stab rein ngan par eleng resources ko ainwot takata najiri aga takata kerai gamanangi ngerorai kamanangi aromeyor ja eorair nangan mejilo kalau malah jangan ko air par ainwot physical therapy nganir rome or kejo merajai orai kes management requitar baliter Paraino terutama roile air trainer, paraino cibang ikijien nutrition akan mengaku merene dengan air pake, elik dada cibang lelak wunongan air.
And then last, this is probably the most important slide for the school-based health clinics, is that who can access our clinics? Anyone. I'm gonna say that again, anyone can access our clinics. Students are the priority. They do accept Medicaid, Medicare, and most private insurance plans, and they'll help you file the insurance even. A sliding scale discount fee is available for patients who qualify based on income. And then this is, if you don't hear anything else about the clinics, hear this. No child will be turned away because a family cannot pay. No child will be turned away because a family cannot pay.
Elguna orang kon barcala meni ni gay one rora meron kajar bale klinik ni lo jikuul cabare do ya kanan kajar bale meron kajar bale etalangan em lola tak terin jikuul gain rujukul rain raya oli bien erin rate priority eri chino untada ngayo kwat waram insuran em kwai puci bang ikijien pile arami jerain meron bar cibang yo Wedal ngani perum reji bang yok file injuran ewam. Elanga ko chen meron kalagi or parchuan meri by sliding scale karangan chonin kama ewam ranit. Lewaj wana en air nejlo yokum takde yogi ene. Emeli dada kemi mi jba echap ay gujin wor rujukul em ranit. Chap kari lang lakum takto yogi ngarechen meron kalai. Ngay or chon rujukul aja tala chen meron kalai raja ay gujin nejlo yo. Rechap ay gujin
And then lastly, I wanted to let everyone know that we'll have a student services website with easy access to all of these resources. I'm going to try to have that up by August 24th. It probably will be up in the next couple of weeks. But again, I want to say this to all of our community out there listening. We are here to serve you. Social workers are here to serve you. Counselors are here to serve you. Nurses are here to serve you, and our school-based community clinics are here to serve you. Please access our resources, contact us, and let us serve you.
Emelik dada ngan poto chemlakweo or matanchiri edabrak student services website website ngan chibang rujuguro ene jilang ngan awli ben rayong mana ko yang tabaragot kia moda jan rongole men ran kemi mi jibango ko ne jay gucibang when you dog baran cibang yo gilo chabarot wawen ba kemi perjin ngan cibang yo gilo chabarot ria ko jay gucibang.
Thank you very much.
Ko alabami yo mol ganami gar ko bato gilo yini.